Hi, everybody. I'm Michael Bean, and this is your myfreeactingclass.com lesson for Friday, August 14th. Today's guest is Dr. Allan Frankland, and he is a psychiatrist, and we can look at his bio here for the book that he's got listed on Amazon. He's a psychiatrist, a psychotherapist, and a clinical assistant professor with the University of BC Department of Psychiatry in Vancouver. Private practice, consultant for the Vancouver General Hospital of Psychiatry, and then details about his practice. And instead, I'll let you talk to him. So I think I said this a couple of days ago, but Allan is the parent of an actor who's been studying at the Kids and Teens School that I run for since she was maybe 4 years old. She's been very, very successful, and so he's had a chance to facilitate her through that entire process. And I'm sure as a counseling professional, has like unique insight, based on his direct experience of what it was like for his daughter, to navigate auditions and the anxiety around them. And then in the last year, maybe two, he was running some sample workshops for actors specifically on dealing with audition anxiety. So that's what I'm hoping will get him started talking to us about today. I'm going to pass it over to, I always forget to say this. If you want to find more of these, you go to confidenceoncamera.com. And hey, look at this, friends. I finally updated the website so that you can just go, hey, here I am on myfreeactingclass.com, and oh, dang it, and then I can scroll down and find the video archive right there. So I hope you can see what I'm seeing. I don't know if you can. Now, Dr. Allan Frankland, thanks so much for making the time to join us today, Allan. I really appreciate it.
Yes, of course. Thanks for having me. First of all, can everybody hear me okay? Is my audio working?
The class, we've got 11 people today. We typically get somewhere between 20 and 50 people watch it online. You can see that it's a very mixed group. So the youngest is probably 7. And then we've got all the way through adults. Some folks who have credits and some experience, and some folks who are just thinking about it for the first time and are just wanting to dip their toe. That's just to sort of give you a sense of the group, and now they're all yours.
All right, sounds great. First of all, can everyone hear me okay? Is my audio working? Not hearing anyone.
Oh, Allan, have you got us on gallery view? I've muted everybody so that we don't get background noise from other
okay. I just wanted to make sure that my audio is actually working.
It totally is. Yeah, if you put us on gallery,
okay, good.
We're all giving you thumbs ups.
All right, sounds good.
The top right corner, you'll see the little 9 dots, and you click that, it'll put you in gallery view.
Okay, perfect.
And then you'll be able to see everybody's face.
Let me just get that in position here. There we go. Okay, perfect.
And people can
unmute
themselves if they have questions as well.
Yeah, I'd love to take any questions. Yeah, my background is I'm a psychiatrist, so that's a little different from a psychologist. It means that I've gone through medical school and did training in not just psychotherapy, but also medication treatment. So I have experience in treating people with all kinds of anxiety disorders, but also working actors who struggle with anxiety, like I think most actors do around auditions. It's a strange situation to be in, and I think part of experiencing anxiety with auditions is perfectly natural, but there are also situations where it just gets out of control and really interferes with your ability to kind of do your best in the audition, and that can be a big problem for some people. So it's a little bit different. Sorry, go ahead.
Oh no, as long as you're still on a roll, I was going to prompt.
Yeah, I was just going to say that it can be difficult to give advice about how to deal with anxiety, because people's anxiety tends to be different from person to person. So it actually, one of the pieces of advice that I can give you about how to manage anxiety is to think about and talk about, say, even with parents or with friends, colleagues, anybody that, you know, if you have buddies who do acting as well, you can talk about your experience of anxiety and try and figure out, when does it happen? Does it happen, because often it sort of has a bit of a cycle to it. So sometimes there's anxiety that builds up in between auditions because you're worrying about, will I get another audition? Is this thing going to work for me? Is acting going to happen? You know, will I even get a chance to act? So there's anxiety that might build up there. There's anxiety that builds up for some people once they get an email from their agent, if you already have an agent, and you know that there's an audition coming. So there's a different kind of anxiety that can start there. There's anxiety in actually getting down to preparing and wondering, how should I prepare? Am I prepared? I'm too anxious to start preparing. I can't even learn my lines because I've got too much anxiety. I'm too nervous about it. So that can be a problem. And then going to the audition and being in the waiting room can be an anxiety-provoking situation because you see all these other people there. You wonder, you know, different thoughts can come into your head in that kind of situation. You know, are all these people better prepared than I am? Should I have done more? You know, that person has booked so many different projects, and they're probably going to book it. And why am I wasting my time? I shouldn't even be here. So there's that, and then there's anxiety in the actual audition room. And at that point, it's kind of too late to do a lot of some of the techniques that I'm going to be talking about today. At that point, you're kind of in the moment, and your job is just really to be in the moment. So thinking about managing your anxiety at that point, it's probably a little too late. And maybe the best thing at that point in terms of advice would be to try to refocus on listening. If you can kind of, and then this is a little bit like meditation. I know some of you guys are younger actors, and I don't know if you've had experience with meditation at all, or if you know much about meditation. Maybe that's something that we can talk a little bit about today, because managing anxiety has a lot in common with meditation, actually. And some of the skills that one learns from meditation are directly applicable to some of these situations that we're talking about, how to calm yourself down, for example, in the waiting room. If you know a little bit about meditation, that can be quite helpful in that situation. Once you're in the actual audition room, though, like I said, it's a little too late to be thinking about techniques for managing your anxiety. But instead, if you do have experience and some practice with meditation, instead of focusing on your breathing as kind of the thing that you're focusing on in your meditation, when you're in the room, what you can practice focusing on is focusing in on your listening to what is actually going on and what the reader is saying, and listening to the words, listening to what's actually happening, and being in the moment. So that's where the meditation skills can kind of transfer over to being in the room. But yeah, like I said, some of the techniques that we're going to talk about won't be as helpful once you're in the room. But then afterwards, you can have anxiety as well, wondering, well, what's going to happen now? Am I going to get a call back? Will I ever get a call back? And then the call back may or may not come, and then that can create anxiety as well.
Alan, I realized that I should have asked earlier, just in terms of setting foundation. Can you distinguish for folks here when between fear and anxiety, for instance? So we know what you mean when you're talking about anxiety.
Well, yeah, that's a very good question, and I should probably point out that anxiety means different things to different people, because of people's experience of anxiety can be present in lots of different ways. So some people, when they feel anxious, they feel physically anxious. So they're aware of things going on in their body, like your heart can beat really quickly and start to feel like it's pounding out of your chest. Your breathing can speed up. You can get shaky. So there can be physical symptoms of anxiety, so a physical component to it. And then there's anxious thoughts that can happen. So worrying kind of thoughts like, oh my goodness, what's going to happen? This isn't going to work out for me. I'm going to do a terrible job in the audition room. So you can have anxiety related to the thoughts that you're having. And anxiety can have to do with feelings as well. So the feeling of nervousness, as opposed to the physical feelings, although it's kind of connected to physical feelings. So anxiety can look different for different people in different situations. Sometimes, and that's why it's important to kind of reflect on what is anxiety for you, and maybe even write down some notes about, when do I tend to experience anxiety? What does it look like? Is it physical symptoms of anxiety, like the rapid heart rate, like the rapid breathing, the shakiness that can happen? Or is it primarily anxious thoughts and worries that bother you? And when does this tend to happen? Does it tend to happen when you're preparing at home? Does it tend to happen in the waiting room to go into the audition room? So keeping track of these things, I've worked with an actor for a while who had quite problematic audition anxiety. And what this person found really helpful for them was to keep really detailed notes for himself about when he was experiencing anxiety, whether it was physical symptoms like we were talking about, anxious thoughts that he was experiencing, or a feeling of anxiety, like sadness, like if you feel happy or sad. You can also just have the feeling of feeling nervous or anxious or impending doom. And he would write this down, when it would happen, what was the situation, what else did he notice at the time, what happened right before in preparing for the audition, what happened in the waiting room, what happened in the room itself during the audition, and then what happened afterwards as well. And then working together, we started to see that there were some patterns that were developing. And once you know and have a clear idea of what the issue is, then it can be easier to figure out what to do about it. So one of the things that this person found particularly helpful is an approach to dealing with anxiety called acceptance and commitment therapy, which is a really long name, but it abbreviates to ACT, A-C-T for short, which is kind of funny.
So great and perfect.
Yeah, it's amazing. So this has nothing to do with, it wasn't designed for acting, but it works very well for this situation. And basically what it's about is it's combining concepts related to meditation, like I was talking about, concepts related to a very well-researched form of therapy called cognitive behavioral therapy, which is looking at thoughts, looking at your behavior, looking at your feelings and how they all interact, but also combining and pulling in an understanding of your values. In other words, what's important to you in life. So what makes life really meaningful to you? And that understanding that helps give you motivation to kind of work on things and continue to work with dealing with anxiety, which can be a struggle. So let me just think about what would be the most helpful, because I know we're kind of short on time here, and I want to give you guys some ideas about what can be helpful right away.
Even if you think about what was most practically helpful with your daughter, that might
Sure.
Especially because there definitely are some parents who watch this, and so resources both like for yourself, but also to assist somebody else if you're in that situation might be useful.
Yeah, well, one thing that we know is really helpful for people who have phobias, so things that they're scared of, like some people have a fear of spiders, for example. So we know that what really helps with a fear of spiders is kind of gradual exposure to spiders. So you might start with thinking about spiders and spending a certain amount of time just thinking and envisioning a spider, which can be anxiety provoking in itself. But then you increase the exposure to something like looking at a picture of a spider and then maybe seeing a spider in a glass box. And so you gradually increase it. So why I'm mentioning this idea of exposure to the thing that you're scared of is because the more you do the thing that you're feeling anxious about or feeling fearful of, the less anxiety provoking it becomes. So that's one of the things that helped my daughter a lot was actually getting auditions. So getting and going through the process of auditioning and doing many auditions over time, you get exposed to this thing that is initially quite fearful, but the more you do it, the less anxiety provoking it can become. It doesn't always work out that way, but it certainly can. So if you do a lot of auditions, then that can be helpful. But maybe you don't have a lot of auditions coming, like right now during COVID, there aren't a ton of auditions happening. So what can you do? You could simulate auditions. So if you have a friend, an acting friend that can kind of practice with you, trying to mimic an audition as closely as possible, or in classes, that kind of thing, acting classes. The more you do that, and the more closely you try to kind of recreate that audition environment, the more effective that type of exposure is going to be. So exposure can be helpful. The more you audition, the more the less anxiety you should feel. But also practicing auditioning as a skill can help. Preparing well can help, of course. There are other techniques like visualization. I don't know if you guys have heard of that. Some of you may have. So that's the idea of envisioning, taking some time to kind of look with your mind's eye and imagine what you wish the audition would look like. So imagine yourself doing a really great job of auditioning. Imagine the casting director smiling at you and giving you all kinds of praise. So visualization, we know, the more vivid it is, the better. For example, there was a study that looked at basketball players, and they took a couple of groups of basketball players. One group practiced just shooting. So they practiced shooting every day for a certain period of time. The other group of basketball players did not practice. They weren't allowed to practice shooting, but they just visualized in their mind's eye perfect shooting. So they just visualized the ball going in the hoop, doing a perfect shot every time. And they did that for the same amount of time as the other group who was actually shooting. And the fascinating thing that they found was with this kind of vivid visualization, the brain just doesn't know the difference between what you actually do and what you vividly visualize. So the group that just visualized perfect shooting actually improved just as much as the one who was shooting with an actual ball and basketball hoop. So these types of studies tell us that using that technique of visualization, if you do it really vividly and practice it a lot, it can actually lead to improvement in real life because your brain just doesn't know the difference. So that's another technique that can be quite helpful. Other things that are worth sort of thinking about, one is that the idea of state-dependent learning, that sounds like a complicated thing, but it's really not. And what it means is whatever you were doing when you were learning your lines, you'll remember that better and recreate that experience of, however you were able to do that at home, for example, if you're kind of in the same sort of state. So, for example, we know there were studies of people who drink coffee, for example, and I know not all of you probably drink coffee, but maybe you drink some sort of caffeinated beverage like Coca-Cola or something, which I don't recommend because it's not good for you. But what we know is if people drink a whole bunch of coffee and they memorize something, for example, lines, and then they try to recall that without drinking coffee, and then they do another group of people that learn the lines drinking coffee and then try to recall the lines also drinking coffee, that group will actually remember the lines better. So we know that state-dependent learning, this kind of whatever situation you were in, actually matters.
Can I pause you there and just emphasize that? You know, that I run into this even in class, not in auditions. It's very, very normal for actors to go into an audition or into a class and say, well, I knew it perfectly in the hallway. And typically that's because the actor has learned their lines in a calm, safe environment where their heart rate is not up, you know, and they are not under pressure. And so, and so this thing that Allan has just said is extraordinarily important. It also, thankfully, is extraordinarily simple. You know, and so what that means is that, like, if you know from taking notes on yourself that here is how you are going to feel when you are under anxiety, if you can create those conditions at home by like doing your lines on the trampoline or like running around in the park, you know, or doing a complex task with your hands, you know, because it's really mostly the thinking part that throws you off. If you duplicate the circumstances in yourself, that are like the audition, you're so much more likely to remember your lines and to be able to keep listening and stay present in the room. Sorry, Allan, I just couldn't resist coming in.
No, thank you. No, please do jump in anytime. Another thing, sort of I think a helpful take-home message that sort of relates to the science that we know now, which we, you know, something that we didn't know maybe 10, even 20 years ago, but is really clear now from the science, is that, you know, we often think now that we can change our thoughts about things, and that's sort of filtered from science years ago into something called cognitive behavioral therapy. The idea that if you change your thinking about something, that will change how you perform and how you behave in that sort of situation. What we know now, though, is unfortunately that was incorrect. So the idea of trying to change negative or anxious thoughts into positive thoughts doesn't actually work. And we know that because the studies have proven it. So, so a really important take-home message, I think, is that if you have negative or worrisome thoughts, say in the waiting room or in the days leading up to an audition, if you have days, most of the time it's overnight, but the night before the audition, if you have these really negative thoughts, the thing to do is actually not to try to replace them with positive thoughts, because that just doesn't work. It actually makes it worse. What you want to do, and this relates to meditation somewhat as well, is just notice those thoughts. So for example, you could say, aha, well, there's an unhelpful thought that I just had about, you know, there's no point in preparing because this is I'm not gonna book this role anyway. So I might as well not bother. So there's an unhelpful thought. Notice it, acknowledge it, allow it to exist. Don't try to get rid of it. Don't try to ignore it, because both of those things, either trying to ignore unhelpful thoughts or trying to get rid of them, actually make them worse and make them stickier. So we know from the science now that the better thing to do is notice these thoughts, allow them to exist, and then get back to what's called your high value activities. So in the case of preparation, it would be get back to preparing and do what you're actually supposed to be doing, which is learning and practicing the lines and rehearsing and get back to doing that. If you're in the waiting room, waiting for an audition, and these negative thoughts one way to think about it is that thoughts and feelings come and go all the time. And we can't control that. Studies have shown that. We can't control what thoughts come into our mind, what feelings come up for us. All we can really control is our behavior. So if anxiety and nervousness comes up, or unhelpful thoughts or feelings come up in the waiting room, the really important take-home message is don't try to get rid of them. Don't try to ignore them. Don't try to change them into something else, like a positive thought. Just simply notice them and acknowledge that they're there. So, okay, there's a thought that I'm not going to book this role. Or there's a thought that this casting director really doesn't like me, and I know that. And so there's kind of no point to being here. There's that thought. That's not a helpful thought, but I'm just going to allow it to exist, and I'm going to get back to, in the waiting room, perhaps it's, you know, going over your lines, perhaps, you know, it depends on what's helpful for you. Some people it's helpful to just focus on their breathing and calm themselves down in the waiting room. Some people it's helpful to kind of review the lines mentally. And that's another thing that's important, is figuring out what works for you in the waiting room just by trial and error and keeping track of it over time. But yeah, the take-home message is, don't try to change your thoughts. Don't try to change your feelings. It doesn't work. And just focus on what does work for you, which is what you need to do, the actual behavior. And in the waiting room, it's, you know, sitting, noticing your breathing, whatever it might be, whatever works for you in the waiting room to try to stay calm and sort of be prepared. Maybe it's visualizing in the waiting room what the audition's going to go like. Does that make sense? Hopefully that's helpful to think about, because that's something where the science is really clear, and yet it hasn't filtered down to sort of people in general, that the idea that positive thinking is going to be helpful. It's not particularly helpful.
Super helpful, Alan. I mean, just getting it from somebody who's genuinely deeply grounded in the science and the practice of it, you know, because there's so much information being tossed around by people, you know, for whom it is just a good idea, you know, and so having you say it, you know, my hope is that it gives it extra weight or currency for people. You know, we had a guest, a young man who's just recently the lead on a TV show, as our guest on the free acting class a month or two ago, who said that before his callback for the lead that he was recently working on, he went into the bathroom and threw up, you know, and then went into the audition and focused. So it's like every single person who comes on and helps normalize, you know, the amount of anxiety that actors manage is helpful.
Yeah. Yeah, so in that example, if this person became stuck on this idea that I just threw up and this is terrible, I'm going to, you know, this audition is going to be a disaster because I just threw up. If they became stuck on that, and in acceptance and commitment therapy or ACT therapy, it's called getting fused to an unhelpful thought, then that person may not have been able to do what they needed to do in the audition room. But instead, I suspect what this person did is just accept it. I just threw up, and just moved on and focused on what needed to happen. And that's absolutely what needs to happen. A couple of other really simple sort of take homes. Avoid anything with caffeine, whether it's Coca-Cola, you know, coffee, chocolate, you know, not for this group, I imagine, but cigarettes for people who smoke. Those things we know can aggravate anxiety. We also know that the amino acid L-Tryptophan lowers anxiety, and that is in milk, cheese, and dairy. So for those of you that aren't plant-based eaters, those things may actually help with anxiety. Another thing is, if you do have an anxiety disorder, like an actual anxiety disorder, it's really important to see your doctor and possibly get a referral to see a psychiatrist who can help you with the anxiety disorder, whether that's through ACT therapy that I was just describing, or some other form of therapy, and sometimes even medication can be helpful. For the actor that I was describing earlier, this person had some issues with being quite shaky and sides that were shaking, like visibly shaking in the audition room. And there's a medication called propranolol, which has been known to be helpful for performance anxiety, for example, in people who play music in orchestras can get performance anxiety and their hands shake, for example, while they're trying to play the violin, which is not helpful. So, so the medication propranolol can be quite helpful for those physical symptoms of anxiety. And in cases of anxiety disorders, there are medications that help with serotonin levels in the brain, which can be helpful as well, though an actor has to be very cautious with the use of some of these serotonin promoting medications, because for some people, one of the side effects is a disconnect with one's own sort of feelings. And if someone gets that side effect, that's kind of works against the whole acting process. So one has to be pretty cautious, I think, with some of these serotonin medications. There are other medications that family doctors might suggest, like one of the common classes of medications that might be suggested by a family doctor is called benzodiazepines. You may have heard of Valium, that's in that class of medication. Ativan, some people may have heard of. And I don't recommend the benzodiazepines either. And the reason for that is because they kind of act a little bit like alcohol. So they make people a little bit sluggish. They slow down your reaction time. And so you're not really as alert as you would want to be in an audition. So benzodiazepines like Valium or Ativan typically aren't particularly helpful. And again, for the adults listening to this perhaps afterwards, alcohol is also not helpful for that, for the same reasons. So avoiding alcohol before auditions is really important. But there are some medications that can be helpful in specific situations, and the shakiness and the rapid heart rate, propranolol, like I said, can be helpful. So a person could ask their family doctor about that or get a referral to a psychiatrist about that. And for some people, the serotonergic, the serotonin type medications, and these are medications like Prozac, for example, that almost everyone's heard of. There are newer ones, but that's the category that I'm talking about. They can be helpful for some people. They can be tremendously helpful for some people, but you do have to be cautious about, does it lead to sort of a disconnect from your own emotions and feelings? So that's just something to be careful of.
Allison Arrea, who's an instructor at my school for years and has been quite a successful actor and acting instructor, both in Vancouver and now in Los Angeles, talks about how in her very first audition, it was one line, and her paper was going like this. And they still hired her for that one.
Yeah, that's right.
Right. That one of the other things I think about normalizing audition anxiety is that everybody gets elevated, when they're in a performance environment. Like just having that feeling is not does not disqualify you from it, because honestly, everybody in the process knows that you're going to be elevated. Yeah, I think that a big part of the practice is the noticing that Alan's talking about and going like, oh, right, this is allowed and I can still perform even with this in my body.
Yeah, just sort of accepting it. Okay, this is happening, but I need to focus on the moment, what's going on right now. That's where you're going to get your actual benefit is to notice a feeling, notice a physical sensation, but don't get hung up on it. Don't get preoccupied with it. Don't try to do anything with it. There's nothing that needs to be done. Thoughts and feelings come and go on their own. We can't control when they come. We can't control when they go. So there's no point focusing on that. What you need to focus on is what you need to do, what needs to happen.
Beautiful. We're just a couple of minutes after 4. Alan, how would you feel about taking a question or two if there are some?
Absolutely, yeah, for sure.
Does anybody have a question for Alan? Great.
Hi.
Deborah.
Hi, Alan. Thank you very much today for this. I was going to ask you, Michael had mentioned that you've worked with actors. Is that an ongoing thing, or was it just a one-time thing?
So I have a private practice. That practice has been full for the last couple of years, but I'm passionate about this particular issue. So if you or you know someone who might be interested in doing that work, basically what they would need to do is just send me a referral. So they would see their family doctor or a walk-in clinic doctor, but what I would ask is include that the family doctor or the walk-in clinic doctor include in the line of the referral reason for referral, that this is an actor seeking help with audition anxiety. So I do decline any referrals right now to my practice in general, but if I see that, I'll take special notice of it and I'll try to fit them in if I can and see if I can help out.
Oh, that's
very much. Thank you.
Yeah, of course. Anybody else have any questions about any of this stuff? I know some of the stuff I was talking about kind of involves some bigger words and things that don't, scientific language that may not make sense. So if any of that wasn't clear, please ask and I'm happy to clarify it.
I also tried to take some point form notes, and I included those in the chat, for anybody, who it's helpful to see it, in addition to hearing it, and Allan sent me a handout on ACT therapy, and I'm going to make that handout available, and I will give you the link when I see you on Monday.
Great. And also in that handout, or at the end of that handout, are a couple of resources. So there is an acceptance and commitment therapy self-help workbook out there. So I included the name of that in case anyone wants to look into that, or ACT therapy. And there are free resources online for ACT therapy as well. Some of the concepts and basic ideas available for free. There's some kind of entertaining animated videos, and I included the link for that as well on that.
Okay, actually, I've managed to put that into our Dropbox folder right now, and so I'm putting that into the chat window. If anybody wants to know more, that handout, including the resources, you just click the link that's in the chat window, and make sure you do that before we end the meeting. Okay. Last chance. Anybody got questions, for our resident psychiatrist, acting anxiety expert?
Yes. Sophia, did you have a question there?
No, I think she's just flailing. she's just excited.
Right.
Awesome. Allan, thank you so much for making the time again. Really appreciate it.
So welcome. I hope it was helpful.
So helpful. Just like so much concise information in such a short span of time. Really grateful.
All right.
Everybody, I've got an amazing lineup for us next week. I've got actress Amy Farrington, who's currently working on a show in LA, started as a theater director, and I've got a stunt coordinator who's worked on Game of Thrones and Batwoman, and he's going to come talk to us about stunts. Plus, we've got Michelle doing voiceover. Plus, we've got Liz doing voice. Oh my God, next week's going to be amazing. So everybody, unmute yourselves and say thanks to Allan before he goes, would you please?
Thank you.
Thank you,
Allan.
Thanks for attending.
Thank you,
Thanks, Michael.
Thanks again, Allan. Really appreciate it.
Franklin. Bye, everybody. Bye.
Bye.
Bye.